Okay, finally we are moving on to the pathology associated with the third nerve. So, and primarily we'll discuss first the third nerve palsy. And the third nerve palsy is nothing but the loss of function of the third nerve resulting from various etiologies. So, a third nerve palsy can be divided into two. One is the pupil sparing, and the other one is a pupil non sparing or a non pupil sparing third nerve palsy. Now, these are fairly complicated and difficult terms, and before we dive into these, let's just discuss what can happen once the third nerve is paralyzed. Remember, the third nerve is supplying muscles of the eyeball, and which one of them? All muscles of the eyeball except for superior oblique and lateral rectus are supplied by the third nerve. So once you can imagine, once the third nerve is paralyzed, all muscles of the eyeball will lose function except for the superior oblique and lateral rectus. So what does the lateral rectus do? It is basically responsible for outward movement of the eyeball, okay, a lateral gaze or abduction of the eyeball. And what is the function of the superior oblique? This one is a challenge. If you're saying it causes depression of the eyeball, you're absolutely correct. It also causes something called an intorsional movement of the eyeball, which is a medial rotation of the eyeball, like this. It moves it around like this. Okay. So you can imagine, once the third nerve is paralyzed, what's gonna happen? The superior oblique is gonna function very well. The lateral rectus is gonna function all right, and the eyeball is gonna point downwards and outwards like this. Okay. So in addition to this, what's gonna happen? Remember, the third nerve is causing constriction of the pupil. So once the third nerve is paralyzed, the pupil is going to be fully dilated and blown like this. So this is actually a result of total loss of the third nerve function. In reality, it doesn't happen like this. Usually it doesn't happen like this. So now we'll talk about the pupil sparing and the non-pupil sparing third nerve palsies. Okay, what is a pupil sparing third nerve palsy? Let's talk about this first. Actually, if you can imagine, this is the third nerve. The parasympathetic fibers travel on the outside of the third nerve, like this, on the outer, basically periphery of the third nerve. The motor fibers are actually traveling in the center of the third nerve, in the central part. Okay, so what happens is, in condition which affect the vessels, like diabetes, like other conditions like vasculitides, okay, the blood supply is going to be reduced. And which area is going to suffer the most, the periphery or the central portion? Of course, the central part is going to be suffering the most, if the blood supply is actually lost. So conditions like diabetes and vasculitides are actually causing problems with the motor function of the third nerve, which is a muscle, while sparing the parasympathetic supply. The pupil is all right, but the third nerve is paralyzed. This is the pupil sparing third nerve palsy. What can happen during a non-pupil sparing third nerve palsy? Non-pupil sparing. What happens is, in conditions like tumors, the big one is actually the tumor, which compresses both the outer and the inner part of the third nerve. It actually causes total loss of the third nerve. This is actually a non-pupil sparing third nerve palsy. Also, something called cavernous sinus thrombosis. Now, from basic anatomy, you might as well remember that the third nerve actually passes through something called a cavernous sinus before it enters the orbit. So, thrombosis of this cavernous sinus can actually cause destruction of the entire nerve, both the fibers, outer and the inner. So it causes a non-pupil sparing third nerve palsy. Understood? Clear? So I hope you understand this. If you have any questions, keep me posted. This concludes our lecture on third nerve palsy.